Welcome back to Cancer Buzz. I'm your host, Summer Johnson. Cancer Buzz is reporting this week from Washington, D.C. at the ACCC 50th Annual Meeting and Cancer Center Business Summit. That's right, ACCC is celebrating 50 years of resources, research, and collaboration with oncology professionals. One of the topics we're diving into this week is comprehensive cancer care services. We're here with ACCC past president Krista Nelson. Krista is the program manager of quality and research, cancer support services, and compassion at Providence Health and Services. Krista, it's so good to see you.
Oh, thank you so much, Summer. It's
Thanks
great to be here.
for stopping by. How did you become involved with ACCC?
Gosh, it was a while ago. I don't know the exact year, but what I can tell you is that as an oncology social worker at my Cancer Institute in Portland, Oregon, I applied to win an Innovator Award, which is this great opportunity to kind of get your programs highlighted within conferences. And I developed a program for kids whose parents have cancer. And I got this letter. I was so excited I won. And it was an all-expense-paid trip. And it happened to be in my hometown of Portland. So I give them a hard time that they picked me because I didn't cost anything. But it was a great way to kind of learn about the organization. I feel like just even today, I'm feeling just reinvigorated in the work and inspired. And it's just so incredible to be around people who all have the same goal, even though we all have different roles. One of my favorite things about ACCC is all the multidisciplinary people who partake. And I just think the connection is life-giving. So I'm just glad to be here today.
What about some of those relationships that you've been able to make professionally through ACCC?
Yeah, I think ACCC has really been an opportunity for me personally to grow. I think as an oncology social worker, we are very patient-centered. We're also very system-focused. ACCC has felt like a perfect home for me because it connects the systems and all the people that work to help support patients to get the highest quality, best cancer care available. The people here are just, I think they've been so supportive of my career, but also just amazing humans. So I'm having a great time reconnecting, especially after the pandemic, and just kind of feels good to be back together.
Absolutely. You were president of this organization during part of the pandemic. You're using that experience from the pandemic in your own career and also leading ACCC to launch ACCC's Institute for Comprehensive Cancer Care Services, which just opened a few months ago. Tell us about the Institute and what do you want to do with this program?
Yeah, I think as president, you have this platform. And, as an oncology social worker, of course, I was interested in promoting psychosocial care, supportive care, all these things that help support patients along their journey. And I think as I stepped out of the presidency, I still wanted supportive care and these comprehensive cancer services to be a part. My goal is that they become standard of care for patients. And so with ACCC's help and a lot of amazing people, we've been able to launch this institute. And this will be a home for many of the things that ACCC has done along the way, but also an opportunity for us to continue to do some incredible work.
What are some of the tools that cancer centers can expect from the program?
I think, we've done a few things as we've launched this institute. And one was that we had a mental health institute. And out of that came these world experts really in psychosocial care and sort of what should we do? How can we come together to support patients? And one of the opportunities that came out of that is this idea of having a how-to guide and how we can promote a collaborative care model, which a lot of experts feel like this is really the way that we should be providing psychosocial care. Another thing is around how we support caregivers. As we know, burnout, resilience, workforce issues are such an important piece. I think that also can fall under this institute. Really just health literacy, nutrition support, patient navigation, sexuality, exercise medicine, nutrition, all of these services that we offer to patients that don't often get the attention. This is a place where people can come and we can do research and we can get the best practices and get them out to our members.
but often impact the patient journey so much that it impacts outcomes as well.
Yeah, and I'm so grateful you said that, because I want to say this, is that, as an oncology social worker, we've been doing navigation for over 120 years, and we know that social determinants of health have more impact on patients' outcomes than a lot of the chemotherapies we offer. So it's amazing to be getting this attention, paying attention to social drivers of health and how we can assess them, how we can treat patients, how we can support them through their cancer journey.
Are the tools free, and where do we get those?
Oh my gosh, everything will be free, which is amazing, and the tools will be available on our website.
Thank you, Krista. Enjoy AMCCBS.
Thank you.
You can find links in the show notes to the Institute and resources for comprehensive care services. That's it for today. Meet us right back here tomorrow for the latest announcements and updates from the 50th annual AMCCBS. I'm Summer Johnson.
This show is a resource of the Association of Cancer Care Centers.